Hello everybody. The subject is data science in healthcare. In today's video, we will be focusing on these topics. Why do we use data science in healthcare? Applications and use cases of data science in healthcare. Role of a data scientist in healthcare. Benefits of data science in healthcare. General perspective about digital health data. Their potential and challenges for research and use for retrospective analysis and modeling. So basically we are focusing on the unit 1 in brief. But before going into those topics, there are few related terminologies because data science in healthcare is a topic which comprises of multiple entities, multiple domains, be it doctors, be it patients, be it pharma team, be it lab people, so be it machine learning algorithms, be it terminologies related to medicine area, and integration of data science in healthcare related new terminologies which are evolved. So first we'll try to focus on the terminologies which if we go through we may be able to connect with these topics of unit 1. So I have just used Google these terminologies and used ChatGPT also to. So let us look at the key terminologies in data science for healthcare. One term is ICD-10, which stands for International Classification of Diseases, 10th revision, a coding system for diagnosis and health conditions. So ICD stands for what? International Classification of Diseases. Next term is SNOMED CT. It stands for Systemized Nomenclature of Medicine. Clinical terms, a comprehensive clinical terminology for electronic health records. Next term is LOINC. Logical Observation Identifiers, Names and Codes. Standard for lab tests and clinical observations. Next term is RX norm. It's a normalized naming system for clinical drugs, providing standard names and identifiers. HL7 FHIR. HL7 stands for Health Level 7. FHIR stands for Fast Healthcare Interoperability Resources. Standards for Healthcare Data Exchange. SMART on FHIR is an open standard that allows third-party applications to integrate with EHRs using FHIR. CDS hooks. CDS stands for Clinical Decision Support, and it's a standard for integrating decision support into clinician workflows. You have PDSA cycles, plan, do, study, act cycles, a quality improvement method in healthcare. Trials, they are clinical trials. OMOD, OMOPCDM, Observational Medical Outcomes Partnership Common Data Model, a standardized format for observational healthcare data. Then you have GLMs, Generalized Linear Models, Survival Cox, Survival Analysis and Cox Proportional Hazards Model for time to event data. You have ARIMA, Auto-Regressive Integrated Moving Average. It's a time series forecasting model. You have RNNs, Recurrent Neural Networks. You have Transformers from large language models, generative AI. You have various machine learning approaches which you are aware of, tree-based machine learning like decision trees, random forest, gradient boost, which are used for classification and regression. You have deep learning for images, natural language processing. You have CNNs, LSTMs, transformers for medical imaging and clinical text analysis. Causal ML. Under this come uplift modeling and meta learners for estimating causal effects of interventions. You have internal validation, cross validation, and bootstrapping. You have external temporal validation. You have transportability, which indicates ability of a model to perform well across different healthcare systems. Calibration indicates agreement between predicted probabilities and observed outcomes. Clinical utility, evaluating models with decision curve analysis for usefulness in practice. Prospective silent trials, deploying models in real world settings without influencing decisions to assess performance. So this was one PDF related to the key terminologies in data science for healthcare. I have one more PDF. Let us look at this. So clinical decision support. So these are the systems that provide clinicians with data-driven insights to support medical decisions. It may be a risk prediction for sepsis or acute kidney injury. The short form is mentioned as AKI, and hospital readmission. You have medical imaging, which may be used for identifying tumors, outlining anatomical structures or disease regions, grading disease severity. So NLP will be giving you insights from unstructured text into EHRs. They may include phenotyping, which indicates characterizing patient populations, cohort discovery, which indicates identifying eligible patients for study, adverse event detection, which indicates spotting drug reactions or complications. You have OCM, operations and capacity management, uh, to improve the healthcare system efficiency. You have emergency department crowding forecasting. You have optimizing operating room scheduling, managing staffing levels to balance demand and resource availability. You have population healthcare and surveillance. This is analytics used to monitor and improve health outcomes across populations. It can be outbreak detection for infectious diseases. It can be identifying vaccination coverage gaps, incorporating social determinants of health. So here the short form is mentioned as SDOH, which stands for social determinants of health. So these were the two PDFs which helped us in understanding the key terminologies in data science in healthcare. Then we can move to the syllabus points of Unit 1, which are why do we use data science, applications, role of a data scientist, benefits of data science, general perspective about digital health data, potential and challenges for research and use for retrospective analysis and modeling. So we'll quickly go through it. Why we use data science in healthcare? So healthcare is complex, right? You have high volume, high velocity data. You have electronic health records, images, lab tests, claims, registries, genomics, real-time streams will be coming from wearables and monitors. So data science will be helping in converting these heterogeneous data into actionable insights by discovering patterns, predicting risk, personalizing treatments, streamlining operations, and informing policies. So cost is rising. There are constraints in workforce. There is aging population. So for all this and for all the heterogeneity and for all the complexity, data-driven tools from data science can be used to improve outcomes, safety, equity, efficiency. Applications and use cases we have covered in another video. We'll be sharing the link for that, but still we'll be quickly referring few of the applications wherein we have the key terminologies mentioned. Like for example, you have operations and capacity where ED crowding forecast is mentioned. Then you have population health and surveillance where SDOH analytics is mentioned. What is the role of a data scientist in a healthcare, right? So he'll be translating clinical and operational problems into data questions with measurable outcomes. He'll be performing data access and governance, for example, PHI handling, IRB approvals, data use agreements. He'll be performing data engineering, that is ETL, from EHR claims registries, and as well from various terminologies which I just mentioned, like ICD-10, SNOMED CT, LOINC, RX norm, HL7 FHIR. Analysis and modeling using descriptive analytics, causal inference, time series survival, development and validation, drift monitoring. He'll be using responsible AI for bias assessment, explainability, uncertainty, calibration, human in the loop. He'll be doing productionization with MLOps, integrating with clinical workflows. So here, smart on FHIR, CDS hooks are mentioned. Change management and evaluation, PDSA cycles and trials. Communication, he'll be collaborating with clinicians, nurses, pharmacists, quality officers, and IT, publish documents, educate stakeholders. Benefits of data science in healthcare are better patient outcomes, early detection of diseases, precision therapy, fewer adverse effects, operational efficiency in the form of reduced delays, optimized throughput, lower cost, expanded access through telehealth triage, remote monitoring, multilingual assistance, higher safety and quality through standardization, automated checks, continuous monitoring, accelerated research through faster cohorting, reproducible pipelines, learning health systems, equity insights through identifying disparities, target interventions, monitor fairness. So coming to the general perspective of digital health data, you have various data types in the form of electronic health records, images, waveforms, labs, meds, procedures, claims, registries, PROs, PGHD, genomics, HDOH, device wearables, environmental data. What are the strengths? Scale, longitudinality, real world practice variation, external validity, rapid cycle learning. What are the challenges? Missingness and measurement error, coding shifts, confounding and selection biases, dataset shifts, operability gaps, privacy and consent, governance and security. Interoperability foundations, so various standards like FHIR, HL7, clinical terminologies and data models. Coming to the retrospective analysis and modeling and the potentials and challenges involved. Coming to study designs, we have cohort case control, target trial emulation, synthetic controls, registries, pragmatic trials. We have bias mitigation, confounding control via matching, stratification, propensity score, inverse probability weighing, negative controls, sensitivity analysis. For modeling, we'll be using ARIMA, RNN transformers, NLP, causal ML. For validation, we'll be using bootstrapping or calibration, temporal transferability. For deployment and monitoring, we'll be using MLOps, real-time inference, bias and drift monitoring. For governance and ethics, we'll be referring IRB, data minimization, HIPAA and GDPR, consent and reconsent, model transparency and equity audits. So this was a small video which tried to cover the basics from unit 1, and whatever the terminologies were involved, those terminologies we tried to cover here. So thank you so much.